Hello, this video will be covering palliative care, and we're going to start with the definition. So it is an interdisciplinary medical caregiving approach aimed at optimizing quality of life and mitigating suffering among people with serious, complex, and often terminal illnesses. All right, so we got that out of the way. It is important to remember while we're working with infants, or this is all about neonatal care, that babies unfortunately die just like our older adults and older populations. So it is not something that we want to pretend like it doesn't happen. And we're going to pay attention to this. It's not a big test area, but in your eventual practice, it is going to be very important. So what is it? So let's talk about goals first. So our goals are to improve communication and improved family-centered care. I can't get this to type. Ultimately, if this is going to end up in death, because this might be just patients with chronic pain, chronic problems like that, but if it is going to eventually lead to a death, we want peaceful and dignified death. So we don't want them to suffer in their last minutes or days. We want them to go peacefully with their family at their bedside in a controlled manner. And this team's going to help us make sure that we're achieving this. So down here, we've got a couple approaches to it. So we have what's called models. And with these, we have just two different ones. So we have our consultation. So this is where you'll be working, you'll have a patient that you don't think is doing so good, and you'll call them saying, hey, we have this patient, I think you should check them out because the XYZ is going on. They'll come, they'll do their consult, they'll get involved. The timing of this might be not the best. It could be too late. The family might not be ready. A lot of things that could go wrong with this, but there is a better approach. We do have the integrated model, or each approach has its benefits and disadvantages. So the integrated model is make sure they're involved early. So we have an infant that we think may be at higher risk of death than others. So we're going to get them involved right out of the bat. We're going to let them know about this. They're going to meet the family and just say, hi, I'm Dr. So-and-so or Nurse So-and-so. We're with palliative care. How are you doing? We work a lot with babies, blah, 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 and build rapport, establish that relationship early, build that trust early. And that's what's really going to help this flourish. It's making sure that relationship gets built before things go bad. They're going to go with an ongoing assessment. And it's going to transition a little bit to when our goals change. So when we're going from what's called curative treatment to end-of-life care. And then at the very end, we have our bereavement. Okay. So let's talk about our paradigms a little bit. So we have different paradigms of care. One of those being end-of-life care. The other one is what we just talked about a second ago, is the curative model or curative paradigm. So when we go to the hospital, we're looking to cure disease, cure treatment, or cure any ailments, make these patients better. But at a certain point, if things aren't looking like they will get better, then we're going to go towards palliative care, making sure they're comfortable. We talked about just about everything in there. So again, quick one. We're not talking about a whole lot for this, but once you get into real practice, it is going to be a bit of a bigger area.